Narcan is credited with saving countless lives by reversing the effects of an opioid overdose. More and more police officers, firefighters, and paramedics are carrying Narcan, and there's a push to make it available for families as well. Tapestry Health and Gandara Center are joining to offer Narcan trainings for family members, with some of the trainings offered in Spanish as well. Carolee McGrath sat down with Liz Whynott from Tapestry and Lisa Brecher from Gandara Center to learn more.
Yeah, we recently received a grant from the United Way of Pioneer Valley to put on a series of Narcan trainings for the entire community. So throughout October and into November, we've been doing trainings in the evening at locations where we hope community members have easy access to. And we've been trying to target people that don't easily have access to Narcan, whether it's through just physical access or whether just not really having an understanding of it. So we put them on in Ludlow, Palmer, Chicopee, and other places. And as part of that series, we're also doing a couple Narcan trainings, all in Spanish, and we're going to be, we have one in Holyoke, and then we also have one in Springfield coming up to really try to engage the Latino community in the area more, and try to increase our ability to educate about what Narcan is and the effects of it and how to use it.
Well, let's talk a little bit about that because you have it right in front of you.
Yes.
And it's a spray.
Yeah, it's a nasal spray, and it's very easy to use. It's one step, and basically, our training is about 20 minutes long, and we like to talk about how to recognize an overdose, how to respond to an overdose. And and that includes how to administer Narcan. So the Narcan part is basically, if you do find somebody that is in an overdose, you would literally stick it right up their nose and press this button. I always compare it to Flonase. It's kind of a similar type of spray. And what this does is it basically enables the person to start breathing again. And that's the only thing that it does, through removing the opioids, taking them off of the brain receptors that they're attached to.
Okay, and what is the response from people who have gone to some of these trainings? Are they nervous? Are they apprehensive?
Sometimes people are apprehensive at the beginning of the training, and that's totally fine. We always say you don't have to take a Narcan kit at the end. You know, we're just here to educate you. You're totally fine, however you feel. And overall, we always have an overwhelming amount of positive reactions from people. I think talking about it makes it less scary because witnessing an overdose is obviously really scary. So we think that the more people can prepare for it and understand it, the better. And since now that this tool is available for people that are at high risk of witnessing an overdose, if they have family members that are have an issue with opioids or friends, then this is a simple and safe thing to have around and to use it in case they do witness one.
Okay, so let's talk a little bit about the numbers. The number of fatal opioid overdoses, in 2017 did go down, but that doesn't speak to the whole story in the state.
That's right. So as we saw the rates go down, if you drill down further into specific demographics, that wasn't the case in specific communities and among some of the minority populations in our area, Latinos being one of them. So that and African Americans actually saw quite an increase, and at least in the Latino population here locally and throughout the state really. It's an epidemic that they've been dealing with for quite some time, long before it became an epidemic statewide and where everyone was talking about it. And even as recent as data from 2016, we think that it is pretty much double the rate that non-minorities face. So in the Latino community, it's one of the areas that it's getting the hardest hit. And there's a number of reasons why. And of course, we are a large Hispanic serving organization. So we take what our consumers tell us and the people that we take care of, and we try to collect as much from them as possible. And we stay as culturally competent as we can by hiring culturally competent staff, bilingual, bicultural. In that, what we gather really that one of the biggest barriers, aside from just social disparities that are talked about a lot, really is the stigma. And it's something that I think is fairly prominent among anyone with substance use disorder. But there's something about this culture that I think there's a little bit of they're a step back away from it. They're a little further behind, if I may say, in accepting this as a disorder. And so that's part of the work that we do, and folks like Tapestry and other really great organizations in this area. Half of the work is really getting people to understand this as a disorder and as something that can be treated and as a disease. And I think once that's there, that piece is there, it just opens the gates to getting people educated and informed and getting them into treatment, getting family and loved ones to recognize signs and wanting to help. And so the Narcan was just such an easy fit for us, in a sense, to reach out and say that this is a community that really doesn't know about Narcan, and I think doesn't know that it's out there as much. They're not talking about it. So something Liz and I talk about a lot is just, again, that conversation, getting the conversation started around the fact that this is something that's affecting people, affecting families, affecting everyone, really, that it's a community-wide issue and a community-wide problem, and how do we just educate ourselves and arm ourselves with the best way to help people struggling with it.
But it has to be terrifying for like a mother, you know, maybe who's now raising her kids' children, her grandchildren, to walk into a workshop like this and realize I have to learn how to use Narcan. How do you break that barrier down and help that family, you know, move forward?
That's right. It's difficult, and as far as in specific communities, sometimes the language is that first step, is really quite literally being able to speak to them in their language. I think that somebody walking in who already has a bit of hesitation and perhaps shame or just fear, the second that is taken out of context of being, you know, us versus them, and you're speaking their language and you're from their community, I think that creates a real pathway automatically. Secondly, I think, again, is education, really, is that understanding that, you know, I don't necessarily always like to make this comparison, but I think it is so powerful, and something people have said many times. It's not, you know, mine to my credit, but it is, you know, we treat cancer one way and we treat a substance use disorder a very different way. And, you know, if this mother had a child who was suffering from cancer, she would do everything she could to ease the burden, to make them feel better, to save their life. She would get them the treatment that they needed. So why is the conversation so different when their child is suffering from a mental health issue or a substance use issue? So just creating that conversation that it's okay, that you're here to protect your loved ones, and that this is a first step, this is harm reduction, this is quite literally saving lives in a very, very simple way that anyone could learn.
Right. And where else can people get Narcan if people can't attend these workshops, and we're just curious?
Yeah, so at CVS, Walgreens, or Rite Aid, they all have a standing order to allow for people to basically just go to the pharmacy without a prescription and talk to the pharmacist, and you can get Narcan right there, and they'll bill your insurance. And that's a really great way to access Narcan, and to say it again, it's all CVS, all Walgreens, all Rite Aid. If, in addition to that, Narcan is available at all of our Tapestry harm reduction sites. We are located in all 4 counties of Western Mass, and people can come in on a walk-in basis to receive a brief Narcan training. And at Tapestry, we do all of the trainings anonymously, so people will get it for free and we won't bill their insurance, which is really important because there is so much stigma and shame around drug use, and that's not only for the people that are using drugs, but that is for the family and friends. So we need to have many ways to offer this life-saving service to as many people as we can.